Je m'appelle Pierre Lebel et je suis le conseiller syndical à la
I am
formation.
the union advisor for training for the National Capital Region for PSAC. In the name of, on behalf of Alex Silas, Regional Vice President, I welcome you to this seminar on coming back to work following the COVID-19 health crisis, an approach to transitioning
To hear the presentation in the language of your choice, please click on the interpretation icon at the bottom of your screen and select the appropriate language. So you'll see at the bottom of the screen, you have like it says interpretation, and then you can select French or English. Alors, je vous rappelle que nous offrons l'interprétation simultanée durant ce webinaire.
We have simultaneous interpretation for this webinar, and we invite you to choose the language of your choice by pressing on the interpretation icon and choosing the language in which you'd like to listen. So I am switching back and forth. You should be able to see now if it's working or not. If you don't hear one or the other of the languages, raise your hand and we'll try to get it sorted out for you. So just a moment for you to set up your interpretation. If you are comfortable in both languages, you can leave it on floor where you'll hear the spoken language. So this webinar is a two-part session. First part will be presented by Martin Chadoin, professor at Organization Human Resources at UQAM, and he's also a research assistant in work at the Robert-Sauvé Institute at the IRSST.
For returning to the office and facilitating the transition to forms of work organization. He will also discuss adaptable proposals to guide organizations as they reopen their offices and help those who are involved in these processes, including unions such as PSAC, think of ways to bring them to fruition. Mr. Chadoin's presentation will be in French and should last about 40 minutes. The second part is a question period. Mr. Chadoin will be accompanied at that time by Maud Gonella. She's a scientific professional at the IRSST and one of the co-authors of the study. Maud and Martin will be able to respond to your question in English or in French. Alors, pour vos questions, pendant la présentation, vous pouvez déjà nous les envoyer.
Questions during the presentation, you can send them to us in the Q&A section at the bottom of your screen. So please put your questions in that Q&A section and they will be read by my colleague Marc Bellin through our 40-minute question period. Please note that we will only entertain questions relating to what we are discussing in the webinar. If you have other questions, such as vaccination mandates or other dispositions that will be set forth, do not hesitate to send them to us, but we will forward them to the appropriate people at the PSAC. So enjoy this session, and I hand the microphone over to you, Martin. Welcome, everybody. I am Martin Chadoin. I want to let you know that I work with the IRSST. I do not work for the IRSST. The IRSST funded this study. So I'd like to talk to you about the study that we published along with my team, whose names you can see on the screen: Bénédicte Calvet, Lise Ledoux, Denis Denis, and Maud Gonella. And this is based on research that we did during the health crisis. In the first months of COVID, we looked at provincial institutions to see what we could draw as conclusions in view of possible eventual return to offices. Now, I am speaking about new organization of work, but in French, it's plural. And it's plural in French because it's not going to be only one setup for return to work. There will be various setups for return to work. And you will see that that's the main thrust of this speech and course for tonight. We'll go to the next screen. So I am a professor in work organization, but as mode, our first responsibility is ergonomics. You may have dealt with an ergonomist before, and you're wondering, why are they coming to talk about this? Whereas they specialize in tables and chairs. Well, an ergonomist can be interested, yes, in sit, stand desks and chairs, etc., but it's not a matter of the person's work. You could have the most expensive chair in the world. If you don't understand if nobody understands what is to be done with this chair, it's worth nothing. So I ask, what do people really do? So goals, training, desks, chairs, setups. How does this all enable them to do their work in a healthy way? When we talk about work in ergonomics, we're not only talking about chairs and tables. We look at all of the elements that come into play in a work setting. So today is not talking about chairs and tables. No, it's talking about the complexity of workplace setups. So why did we drop this guide on returning to work? Well, because we know that, and everybody knows that, we will go back to the office, but return to the workplace won't be the way things were before. We're not going back to the way things were done in the before times, before the crisis. That's the past. We're going to go towards new organizational setups. So we're talking about work from home, flexibility, 3 days at the offices, 2 days at home, and the opposite. But returning to work, the workplace is an opportunity. It's an opportunity for employees to reduce rental costs. You know, in your offices, there might be strategic endeavors that are looking at reducing costs. So there might be hub desking or shared workstations. So these are the types of things that workplaces are trying to put into place or have been trying to put into place. Now, there's also the improvement to work flexibility, and this is something we've been moving towards over the last 15 to 20 years with compressed schedules and part-time work and flex work. So COVID was an opportunity to go towards more flexibility. And the third opportunity that we see is an opportunity to address recruitment issues. So here we say that rendering work more flexible, more accessible, maybe we can make it work more attractive. So it's sort of a marketing approach. If I offer flexible conditions, people will be attracted to my business. So all of these opportunities are open to us, but we have to grasp them and seize them. And what we've seen is that people are going about it in a bit of a problematic way. There are many companies looking at returning to the workplace, and they're looking at it as a centralized approach and not an individualized approach. So returning to the workplace, that's not exactly what it needs to be. We have to talk about negotiating the telework setup in a different way, in a new way. So this is a more risky approach. You know, we might not meet all of the wishes of employees and their needs, because when something is centralized, we don't take into consideration what the person on the ground wants. But now this can happen. But I can't be worked into negotiating a remote work agreement. It's not the same as developing a return to the workplace plan. So we are looking at 2 different processes. When I think about returning to the workplace, yes, telework will be part of it, but we also have to talk about space, usage of space. uses of physical areas, communication, and the work itself, of course. What are people going to be doing in those spaces? So negotiating these telework agreements does not enable us to say or look at how people will come to work, to the workplace. And some people cannot work in telework because of the job they do. Maybe they have to work on a machine that can't be brought home, or because at home, the conditions are not favorable to telework. Maybe there are 5 people in the house in a 4.5 with kids, or it's a noisy neighborhood. I've got a bad connection, whatever. There are a whole bunch of reasons that will prevent some people from using telework. So we have to understand that. How many people in my company can do telework? And lastly, and this is the most important, for the unions, it's the most fundamental and the most interesting part. Employees didn't wait around during this crisis. They didn't wait around for instruction. They reinterpreted health rules. They reorganized their workspace. They took their jobs that they didn't have to necessarily do before and started doing them. For instance, where we observed March 13th, everybody was sent home, except people who were essential workers. And the follow-up and handling files was essential. Some work could be done at home, but various services were deemed non-essential. So for some essential services, we didn't have the work materials that were necessary to be working on. So there had to be many different types of setups made. So people acted and didn't wait around during the pandemic. They interpreted and reacted so that they can continue performing, and sometimes it had an impact on their health, a negative impact. So what is in this guide? This is an open guide on our site, on the IRSST site, in both French and English. So it's not a how-to book. You know, if you do this and this and this step by step, everything's going to work out fine. No, what this is a collection of guiding principles, guiding ideas to help people consider the return to the workspace. Also, in our research, we did not have access to one person, and that's the union person, the union representative. We weren't able to have these people there because there were some hindrances to reaching those people. So we drew up the guide without considering the union aspect of a return to work. So this is important and will come up in the second part of the discussion. So how do you, as union workers, as union members, use what we are offering here and apply it to your workspace, but also to let us know what may be lacking in what we've proposed as a mode for return to the workspace. So what we have here is a broad approach, broad principles that take into account all of the intricacies of returning to the workspace and the workplace. So here are the main principles that we found in the scientific literature and our observations on the ground. So we have 8 principles, and we'll go through them rather quickly so that we don't take too much time for that. But first, upper left, is to recognize the complexity itself. We have to recognize that organizations are complex systems. So that means that you can't take a linear approach, an approach with processes where one step, a flowchart sort of process. No, the complexity is chaos. So if I move something on the left, something on the right is going to move, and something on the top and the bottom are going to move all over the place. So as soon as I put an action onto one aspect, it's going to have a complex on another. It's going to have a reaction elsewhere. So we have to embrace that complexity. Work is a complex operation, and we must take the time to properly understand it. So that's all nice, but how do you go about it? So what we want to tell you is that we need to avoid working in silos, functional silos within the company. So what we saw is that at the beginning, we thought new technologies and our ability to connect quickly with others would enable us a wonderful opportunity for creativity, but we did see that it really feeds into that silo setup. So if we want to think about returning to the workplace, we have to break down those silos. So there's a hint at how to manage the return. Now, I can bet that in many of your workplaces, it's all about hierarchy, and those at the top are going to determine how things work when you return. So we've got to break down the silos. Also, we have to focus on participation from everybody. So we've got to get information from the staff, from the workers, to find out what their needs and wishes are regarding their work and what they need for telework. So this is a guide that we've prepared for managers. What we're trying to tell them is, try to do this collaboratively with your employees, but you as unionists, you are closer to your members and you have a closer access and a finger on the pulse of the people in that workplace and what they need and what they've done throughout the pandemic. Next, we need to talk about progression. We have to look at a progressive approach, a gradual approach. So say 10th of January, 20% of people come back to the office. It's going to be difficult. It's going to be a little chaotic. But the idea is to say that at a certain point, everybody will be back, but let's give ourselves time to let people acclimate to the return to the office. This was a very abrupt break in what we knew. We had to reorganize, relearn, or learn to work completely differently. But when we come back to the office in a more flexible work approach, work setup, it's going to be even different again. So we need to really set the ground properly to facilitate that return. Top right. We also have to focus on the specific nature of work situations. Now, I'm talking to you about an ergonomist, not about tables and chairs, but person who's telling you that when people are working, they're doing more than they're asked for, or they're doing it differently than they're asked to do it. So this is the difference between what is prescribed and what actually happens to be able to carry out the work that I'm expected to carry out. So we have to look at the specific workplace and what actually happens there. What do people actually do there? What are the concrete difficulties that people come upon? And how do they get past those difficulties? That's what we have to think of when we're talking about a return to the office. So we have to look at the real workplace, the reality of it. And that's different for every workplace. So it's extremely important to really consider the individual nature of each workplace. And how do we do that? We open up means of communication with employees and really listen to them. Next, we have to leave room for maneuver. We have to ensure that the instructions that are drawn up give people enough wiggle room to be able to adjust and really adapt to that return to the workplace and adjust what we expect of people so that they can do what they need to do without a whole lot of impact on their health. Because often when we look at return to work, it's a top-down approach. And there are rules, and the rules have to be followed, and that's all. But what we suggest to organizations who are thinking about returning to the office is to leave some room for maneuver, to allow for people to take the time to adjust, to transform their organizations so that they can perform and stay healthy. Second to last principle, establish an iterative approach. And that means that we shouldn't see this as a linear approach from point A to B with a succession of steps, very linear, and we get to an outcome. No, we always have to allow ourselves an opportunity to back up. So imagine that management says it's going to be 3 days at home, 2 days at the office, figure it out. Well, there are going to be local approaches, local adjustments that will pose questions to that strategic approach. So this is an iterative approach where you go back to the strategic plan and adjust it. So be aware that we can move back up, and that's not a problem. It's an opportunity to rejig and rethink how we're doing things. And the last one is a very basic and classic approach to project management. We have to do a follow-up. We have to see how things panned out. How did people feel? How is health impacted? Do people want to leave this workplace because they're no longer satisfied? There has to be a follow-up about the impacts and the local strategies that were put into place. Next slide. Here is the model. So when we did our research, we saw that people reorganized themselves, but not only in terms of telework. The reorganization had an impact on the whole organization. And we're going to go to the next screen to see what I mean step by step. So firstly, so this is telework, eh? We've got noises going on in the house. I beg your pardon. So first is government guidelines and regulations. So returning to work will be impacted by what the government determines to be the guidelines and the regulations. So it's not going to be 100% to return to the office if the government says only 25% of people are going back on January 10th. What we have to be very clear about are what are the guidelines that are coming from above? What are the non-negotiables? Next. And this is very important. Your organization has strategic orientations. As I was saying before, they want to reduce their workspace rentals. They want to have flexible offices with workstations, etc. So there are a bunch of strategic orientations that are at play. But when you go into the process of going back to the workplace, we have to be very clear about what the strategic orientations are. If you develop return to work plans that go against these strategic orientations, things might not work very well. So we have to be very clear about what these strategic orientations are. Now we see the issue of returning to work or telework. And this is not the same thing. The two aren't the same. So telework goes into work organization. Right now, we're looking at organizational impacts of the return to work. How many days will be in the office? How many days will be working at home? 2 days, 3 days, which will it be? But in this area, there are many other things that have to be taken into consideration, especially technology. If everybody works on telework, you have to have all of the computer and internet solutions that are necessary, means for connecting in a reliable way, etc. So there are a whole bunch of issues that will come and play upon this telework initiative. Same as physical space. If you're working on telework, your space will be set up differently. If there has to be social distancing, the spaces will be set up differently. How about the ventilation systems, the air exchange systems in schools, in universities, etc.? How about security matters? If 25% of people go back to the workplace, well, then you have to think about how many first aiders are going to be there, how many security guards are necessary. Lastly, the last two boxes are very important. And these are actually maybe the most important, but also the most difficult to understand. So we've got 5 boxes that are the prescribed model for work. These are instructions, orientations, and wills. But what we must understand is that the choices we make in those 5 areas will have a direct impact on what people actually do, on the work that they do and how they do it, and will also have an impact on their performance. So we also have to realize that this will have an impact on health. In the pandemic, some people were very happy, some working at home, some felt isolated, some were stressed, some had much more work, some had much less work. There were people, workers had all different types of impacts on their health. So if we want to think about a return to work, we really must consider these 2 aspects. What will people be doing and how they feel now and how they will feel as a result of the decisions that are taken in the various dimensions. So here's the model. This model enables us to consider the return to the workplace. So we show this guide to managers saying, if you're thinking about return to workplace, don't forget this dimension. And it's also important for union representatives to consider this too. Firstly, it gives you a way to analyze what is coming up. You can look at this grid and look at what's actually happening on the ground and the people who are working within these parameters. How is it for them? How does it impact them? So following the model, there is a 3-phase approach.
I'll try to hurry up. There's a 3-phase approach. It is simply presented. The first phase is the strategic steering of the development of a return to office arrangement. We have to define the parameter in which we are using the precise and operational return to work models. The second phase, once we developed those scenarios, we need to make it operational. It'll be different according to our unities and our responsibilities, our departments, our teams. So we will need to develop local return to office arrangements. And to finish, I said that there was a difference between what is prescribed in the real world. We have to talk about the strategy and the operations, and there will always be a gap. And, let's not hide ourselves from ourselves that there is a gap. The big difficulty about this is that the mechanisms that started do not really exist in the enterprises. Some of them function in different ways. So what we need is to show to the manager that they need to discuss these. They have to have these modalities because sometimes they will come in, make it difficult to reach the objectives. So the strategies have to be discussed. Next slide, please. So we will talk about the 3 phases. The phase 1. So next one. So this committee, to make it work, I need a rep from every part of this model. It could be the same person or different people. I have to know the person who knows about the safety. I have to know, I need someone who has influence on these strategic operations. I need someone who knows about technological solutions. I need someone for the planning of the space. But especially we need people who represent the work and the employees' well-being. It's very important to have someone who represents the work and employees' well-being. Next slide, please. Once we have everybody around the table, once we have people around the table, you have to develop the first scenarios. We do not have a perfect scenario. It depends on your team, it depends on the technology. So the issue is to agree on a parameter. We need to have ideas. For example, the return to work, it will be decided by each team. Each team will decide how to organize it. So these are strategic orientations. And once we agree on this parameter, next slide, please. Once we did the strategic phase, we need the operational phase. So all the reps received the different scenarios in which we will be developing the local modalities, and we need to establish local committees. We need to find all of the different modalities of the model, and we have to have a return to office arrangement. We have to say that we have to sit down with the workers and think that with respect to the work, how did you reorganize yourself? What happened? What are the decisions that were made? How did things work? And with respect to health, how do you feel? What is your perspective with respect to return to office? How did you suffer or not suffer from COVID during the pandemic? Next slide, please. So this is the model. These are the people who have to be present. And this is a tool that we created. It is something tentative. It's a continuum. It's a continuum that represents the proportion of people who are in the office or remotely at home. We could have 100% people at work or at home and in between. The idea here is to take this tool and try to position what happened during the COVID. So it is the smaller groups, the homogeneous groups, that will be thinking about the return to work. It could be a service, a department, a team, whatever. It depends on the department. And then you ask people, how were you really organized? So if we take the service of insertion, 90% of employees were 100% of the time in the office and 10% were working remotely. This means that it wasn't very equitable. 90% of the employees worked at home and they couldn't work remotely because they worked on a machine. If we looked at the client service continuing line, if we see that 50% were working remotely and 50% a few days a week in the office to take care of the clients physically. And if we take the continuum line for the file tracking and processing department, it's really small, sorry. 90% of employees were working remotely and 10% would come 1 day a week. And that 10% was the one who was opening the mail. I was talking to you about them earlier. Next slide. So here, we're talking about functional units, who was where during the pandemic. Here is an idea about how the telework or working remotely was done. I named 3 services of the same organization, and we had 3 different remote work time. So how could I negotiate a unique type of work for this department? The second thing you need to do is to try to understand the real capacities of workers. Some of them suffered, some of them not. Some of them changed lives, some of them moved. Some of them had nervous breakdowns. Some of them became alone. Others found passions. So next slide. Here it is. This is the state of health understanding. It will help you to look at your continuum. So during the pandemic, 90% of employees were at work in the office, and the 10% clerical work were sent home working remotely. But the 90% who stayed at work, they felt that they've been had. They felt that it wasn't equitable. I don't know. I'm not going to change my way of doing things. I know there's a feeling of inequity, and people will change their jobs, and they won't perform as well. But maybe I can reorganize my work to give them clerical work and give them the capacity to work remotely. Next slide. The last important thing to say, and then there's 2 more slides. We need to consider the socio-affective dimension of work. This is what we tell managers. The managers, they look at performance, productivity, they see performance objectives. But the work objective is human first. Work is done by humans. They're mobilizing their socio-affective part of their lives to do this work. What does it mean? Let's say client service. Some of them are harder than others because there are difficult situations. Some people are poor. There's anger, aggressiveness because there's injustice. Some clients are difficult. So if after having been insulted for 2 years by working with clients, if I cannot just vent my anger to reduce the tension, then the person will burn out. It's the same thing during the training. When I start a new job and I do not have colleagues in front of me because I'm at home, how do I learn my new work? How can I just chat with my colleague for 5 minutes? There is a socio-affective dimension of this work, and it's absolutely necessary to understand this in the different positions, what is happening in that socio-affective dimension of work, because telework completely hid that socio-affective dimension. Next slide, please. So you can see here, this is the file tracking and processing department. Because of that socio-affective dimension, the collective agreed that everybody had to do this rotation. Sorry, it's not the right example. I'm starting to feel tired, but in this service. So every summer in this service, there's full of students. Maybe next year, when all the students will come in, instead of having everybody in telework, during those 3 weeks, we will be in person to integrate the students, to answer their questions, and to make sure the work is quality work. The idea is to continue your continuum instead of having something that's set in stone. Different situations are always different and specific. Next slide. So the last phase. I will go very quickly, and it's the most complex, and I do not have the perfect solution. The idea is to start talking about the local aspects of return to work and the strategic orientations. That's why we're fostering the creation of 2 types of committees, a strategic steering committee and local committees. But it's not sufficient to create those 2 committees. We need to create a capacity to discuss things. We need a mechanism to discuss and to collaborate together so that develop the local modalities. If there's no more strategy and they do not speak with the local and the operational aspect, we can no longer have an efficient and safe return to work. So there will be people who will bypass those modalities and things will not go well. The idea here is to support yourself on the tools that I gave you. For example, the integration model. For example, the IT people are not part of the committee, so we have to make them part of it. So we have to show the diversity of situations. The next slide, please. is the address of the guide. You have it in the chat. If ever you want to consult this, you have our addresses, our email at the beginning of the presentation. Please contact us. If you want to know more, if you want to discuss with us about your process of return to work. We're in the first the first phase of this guide. We have a first version and we want to know how it's used in the workplace. If you're using it, please contact us so that we can discuss it with you or even follow you. And we are interested in knowing how the union can use it because we created for and by the managers. But what is interesting to us is to know the unions. Is it a tool that allows you to analyze the return to work process? I spoke enough. So I thank you. Thank you very much for the invitation. And I'm open to answer your questions. Thank you very much. Thank you very much for the presentation. There's already questions, says Pierre. With respect to what you said, you talked, it's interesting because you talked about that we're waiting for the government guidelines. Since Government of Canada is the main employer of the members, I do not know the employer of every member here, but most PSAC members' employer is the Government of Canada. We have the health process from the province, from the Government of Canada. From one week to another, things could be different. Some things are allowed in Ontario, but not in Quebec. So it's interesting to look at all these guidelines. What I like, we cannot accept what the employee just tells us what to do. We're union workers. We can file grievances. We have tools that allow us to challenge the decision of an employer. Activists are here. Not only it is important to convey to the employer our experience during the pandemic, but when the employer will tell us how we need to return to work, if the employer did not consult us, we can answer, no, it could be done another way. It is very interesting. Now I will go and look at the questions. It's a good time to ask questions. I will go and see what kind of questions we have. So here, Lucy, who asks us, it's been 18, 19 months that we're in telework and things are going well. According to the last figures from the Government of Canada, 85% of employees are still in remote work. Things are working. The government did not fall. The CERB checks are still sent. So is it enough to tell the employer, could we continue this way? Or do we need to engage a more important dialogue with the employer? It's a difficult question because what you're asking is that there are two things. There is there is a relationship of power between the union and the employer. I do not know it all, but it's part of you have tools to challenge them. And there's also the issue about the employer and the unions. Do they have information on how the members are really feeling? So with respect to unions, I don't know. I'll say I don't know, but with respect to the employers, they do not know. I know that the employer does not have that information. They tend to not see what's going on. So in the end, as an activist, how can you speak about the issue at the workplace so that you could question the future organization of work? Let's not fall into the trap that everybody wants to stay at home. Many people want to come back to the office because they're more productive, because they can see colleagues, because they're sick and tired of being at home for all kinds of reasons. Many people do not want to go back to work for many reasons. So we need to know who in your organization wants to go back to work to do what? And that is the question about the work. And who does not want to go back to work in the office? To do what? Because let's not hide the issue of work. Let's not hide what people are doing. You know, it's not just for existential issues that people want to be in the office or in remote work. And in my opinion, the union activist has a role to play to try to get that information. And for the moment, not many people know.
This one would be in English. So basically, there are people who don't want to return back to work. There are some people who desperately want to go back to work because for many reasons that you explained earlier. So how the employers and the employee can manage that for those who don't want at all to come back to the work, but they still want to work, and those who are desperate to be back in the office and work and interact with colleagues. So what the arbitration needs to be done between the employer and the employees?
So again, the arbitration doesn't need to be about individual opinions. It's not about just what I want as a person because I have a nice house in the forest and I want to stay there. I think that the key point is about how my work is possible in my house or at the office, and how my work is gonna influence the work of others. We still have to keep looking at the work. So the key there, and it's what we try to show in our guide, it's about creating spaces where people can talk, where employers and employees represented by the unions can have this conversation. Because if the conversation is not done, it's gonna stay just en français on dit des discussions de sourds. It's just gonna be people talking and no decisions are going to be made. So as unions, I think the key here is to look in the organizational environment and try to see where this conversation can be done and how is it done if it's done actually, if it's done now.
Okay, thank you. Meta nous demande comment convaincre les gestionnaires qui
Convince managers who think in a linear way and who do not want to look at a return to office plan. So Martin answers, this is a very difficult question. And since I am not unionized, I do not work for the union, I absolutely want to tell you what to do in your work, right? However, I believe that in the real work, from what people are really doing, there are all kinds of stories or all kinds of stories that can show you why the employer's decision does not work. So you need to have that narrative with the members and really base yourself on narratives. You know, he wanted to do this, but he realized that it didn't work for such and such a reason. So your work is an investigation work. You'll have to look for the story that will hurt the employer. I think that is how we can come out of it. But it's something very complicated. It's very complex. I'm telling you this. But how to do it tangibly within the parameters of your union, well, that's something else.
So Anne is asking, but that it would be the employer who has the final say.
Yes, it's gonna be the employer, but it's the rules of our system where employers have the right to decide about work organization. But it doesn't mean that you cannot fight this decision or you cannot mobilize your members to try to collaborate with the employer, trying to influence this decision. That's the range of tools that you have. You can be collaborative, you can be more wanting to fight. So yes, it's going to be the employer deciding, but you have some cards you can play.
Okay. OK, merci. On a encore facilement une 15 à 20 minutes
We
devant
have
nous.
about 15 to 20 minutes. So if you have questions, I'm
D'échanger avec Martin.
trying to look at Martin to see what's going on. Sandy is saying she's at 100% in telework, but what she was worried about is how to adapt, when she'll go back to work. In your model, is it dialogue that will allow it? Yes, but the Sandy situation is a situation that will be lived by many people that will be imposed the return to work when for month and month they were used to working differently. So that is why the union actor is fundamental. So individually, every employee cannot do anything individually. I'm not teaching you anything, and that's the principle. Individually, you cannot do anything facing the employer. So strategically, we need to know how the union will give itself the right tools through the real work and the narratives in the workplace so that you could counter that power. But I agree, many people. So if we're forced to go back to work on January 10th without preparing yourself, well, there'll be a lot of suffering. There are departures too, people who leave. This is a message that we can send the employer. If you're not flexible in your return to work, you could lose employees. Absolutely. The word that all employers have is the lack. There is a lack of employees. We have a manpower shortage. Instead of thinking, oh, employees are no longer there, there's a manpower shortage. It's an argument that you can get, your staff's intention of leaving. And maybe the employer will reconsider its way of thinking or managing. So about productivity, do you know about the study that gives you different situations? Productivity in the workplace. We're talking about PSAC, members who work in file analysis services, clerical work, according to your studies. After 19 months of pandemic, according to the studies, is there still a productivity or is there a decrease? Do you have ideas about that? I will ask my colleague Maud, who has a better clarity about the scientific literature about this. Hello, everybody, says Maud. You'll understand if you know the research world. There is very little data. These things will come out later. We do not have any studies. I do not want to give you any figures. So things are going well, but at what price? At what price on people's health? We're all hearing, yes, but we could do the work. We came out of it, but what's the price to pay? That's the question we need to ask ourselves. There's public health, mental health. We had to adapt. And I'm coming back to the previous question. There's a big adaptation, and we need to adapt. It's very difficult. So to answer briefly, we do not have any data. We may have some studies later. Thank you very much. I have someone who asks, do you need individual agreements between the employer and employee? Or should it be done in a more general way with respect to the return to work agreements? So let's be careful about individualizing things. But, for all unions, it's not good for you. If you try to individualize the report and the work, we will create, huge monsters of bureaucratic management. And furthermore, we will not recognize that the work is collective. When I do my work, part of my work I do alone, but after I work in collaboration with other people. With respect to the guide, we did not write it in silo. We had meetings, and because we could meet and we met on Zoom, it wasn't working well. So we met in person and things went much faster. We felt that we did good work, but that's work. Even if I feel that I'm doing a very individual or a loner's work, what I do is collective. So the return to the office should be done collectively, but think about it in a collective way. It doesn't mean that you need to but one return to work. It could mean that there's small groups that will have one type of return to office and another type. But for that, I need to understand the collective aspect of my work. So let's not fall into the trap that it's an agreement for all or it's individually managed. There's so many things in between. Thank you very much.
If you want to put your question in the question and answer box, we'll go to them. Alors, si vous avez encore des questions, il nous reste quelques minutes devant nous. Je vais aller voir dans la liste de celles que
when look at the list, I was mentioning if you have questions with respect to something specific, we will not address all of them. If it has to do with the employer, we will not answer them now. We want to ask general questions. I believe, let me look if we answered Marc. I don't want to put you on the spot. So Marc is our health and safety rep for the region. So maybe Marc has things that he can raise with Martin. Thank you, Pierre. Well, I agree with the comments done by Martin, because too often, in my humble experience, the employer wants to go through all these steps by themselves without the intervention of the union. But it's a question of cooperation.
Most of the times, we know what our members are thinking or what they want, and we can know that quickly. But we're there to represent our members, but we can always get a fast read on their pulse or what they want, be it return to work or whatever the endeavor is, to have things done in a positive way for every member and for all the members. So it's essential that health and safety committees for locals participate in this process, and if the employer doesn't do it, but to inform them and ask them or insist that they be included in the process.
We found over the last few months that because people were teleworking, like green gas emission were lower and everything. Do you think, Martin, that's an argument that employers might listen to at one point?
It's a great argument. Do the employer is gonna listen to it? I have no idea. It depends on the employer. I think there's a lot of employers who are greenwashing the thing. So maybe it's gonna be good for them, but definitely. But we don't have to. We have to not forget that when we work online, there's a big infrastructure. There's a lot of hardware, and there's a lot of gas emission that are not good. So we don't really know if it's better for the environment. Even if we saw the dolphins go back to Venice and everything, we are not sure. We cannot say it's better for the environment.
Yeah, because just like a Zoom webinar like this one takes electricity and bandwidth and everything. Yeah, so it's not carbon neutral
Exactly.
what we do. Stéphane demande, l'étude a été faite avec.
Stéphane is asking this. The study was done with in conjunction with the Quebec government. Was there any collaboration all with the federal government? No, the only ones that we're talking to in the federal sector is you, actually. So we are very interested in seeing how you might put this to use and how unions might put this to use. So we have presented our results to various bodies, and we see some commonalities, of course, in various institutions. There can be a will of institutions to get involved and use this, but we have to recognize that the issue of the return to the office workplace is difficult for managers. It's really complex because they're in a totally new world. How do I control my staff? How do things work? You know, so they too are bogged down by this issue of return to work. So maybe there's a little opening, a window open for the union to find a potential partner, maybe, in issues of work, to have them consider various aspects. So I've put something in the chat for our participants. I put your email there in the chat. Let me just take a look and see if there are any other questions. No, it seems like we've been through all of them.
Few minutes. Need to ask a question, please enter them in the question and answer box, and we'll relay them to Martin and Maude. Laissez-moi vérifier, m'assurer que je manque rien.
Just ensure that I haven't skipped over anything. I think we've seen everything. We've spoken about individuals' desires and collective wishes. So it has to be a global approach. You talked about a group that was present, but they were digitizing documents for their colleagues. So what we see is that the social affective dimension allowed people to decide how they were going to work together. They saw that some people were overburdened, that things weren't necessarily fair. So it wasn't only an issue of equity and fairness. No, it was relationships between team members. So it's very important for that reason to use a collective approach, but not an approach that only has one thrust to it. We have to enable all of the voices to be heard so that we can bring forth the decisions of the employer. So if we talk about health and safety committees, it's important maybe for them to go back and see how things worked out, what can be adapted and adopted from the time where there was a different model of work, and see what can be applied. So it's important that managers hear what has been going on so that it can be taken into account in their decision making. Yes, and that's why we sent out the guide. These people are, don't necessarily know how to do this, but we sent out the guide as a first step, as a guide to moving forward. Well, and I'd just like to make a comment here. The words that we're using to describe this situation are very important, and we had a lot of debate on the terms return to work or return to office. Because if we talk about return to walk, well, then we're denying the fact that people continue to work. And it's very important to recognize that people continued to work during the pandemic. They devised the strategies to get their work done, and they did it well, and sometimes at an expense, at a cost to their health. So we have to recognize this. So it's important to think about the words that are used, and the employer might try to get you to use words that you don't agree with. So you must remind the employer that it's not a return to work. Our members have always been working. It's important to remind them of that. Indeed, otherwise, we're going in the employers, with the employer's perspective, and we're maybe denying what the workers have experienced. So most of the people here tonight work for the federal government, and government services were did continue throughout the pandemic. There were emergency measures that were sent out to people. Those were put into place by these federal workers. It was done within a few days, and Canadians got their checks very quickly. So these are a lot of our PSAC members who got this, who made this happen. So yeah, work never did stop. So people are thanking us, and we're ending a bit early. And I don't think anybody's going to complain about that after a day probably of Zoom meetings. So thank you very much, Maud and Martin, for this presentation. I'll remind the participants that we put the link to the IRSST site to where you can see the guide. So you have the link there in the chat. And as Martin said, it's something that you need to pass on to your managers, to management, so that they can have a different perspective. So thank you to our participants. Thank you for our technicians. Thank you to the interpreters. I hope that everything was fine. I know, Martin, that you did speak a little quickly, but I went back and forth to the French and English channels, and I saw that the information did get through. So it is 7:42, and we'll end here. At the very end, I put in the chat box, I put my email in the chat box. So if you didn't get Martin's email, you can always contact us, and we'll pass the information on to you. So have a good evening, and be on the lookout for our upcoming webinars. Thank you very much, and good evening.